Hello, everyone. Haley, me, and I will be talking about coronary artery disease today. So first, we're going to start off with a brief overview of what coronary artery disease is. So it's the most common heart disease in the United States, and it's usually characterized by a slow progression over many years to decades, but it's important to note that it can also develop rapidly. And it's narrowing, hardening, and blockage of the coronary arteries from plaque, eventual blockage, and plaque is made up of fat, cholesterol, white blood cells, and connective tissue, and the accumulation of all of these is what contributes to inflammation and the plaque buildup on the inside walls of the arteries. And as you can see in this picture, this artery is what a healthy artery looks like with no plaque buildup. This one shows a little bit of plaque buildup, and then this one shows almost a complete blockage in the artery. And that plaque buildup can block blood flow to the rest of the heart, causing the myocardium or the heart muscles to not get enough oxygen, blood, nutrients, and causing it to not function properly. And this can lead to blood clots, heart attack, and other problems that we'll discuss later.
Causes of coronary artery disease begin with damage or injury to the inner layer of the coronary artery. Damage is most often caused by smoking, high blood pressure, high cholesterol, diabetes or insulin resistance, having a sedentary lifestyle, and it can also be caused by hypertension, hypercholesterolemia, diabetes mellitus, and also having a sedentary lifestyle and not being active. Coronary artery disease causes the arteries to look different on the inside, as you can see on the picture depicted on the slide. And the fatty deposits, which is known as the plaque, made of cholesterol and other cellular waste products, tend to collect at the site of the injury. This process is called atherosclerosis. If the plaque surface breaks or ruptures, blood cells called platelets clump together at the site and they try to repair the artery. There's also a possibility that this clump can block the artery and lead to a heart attack in severe cases.
So now I'm going to talk about the mechanism behind coronary artery disease. So Haley already discussed that plaque begins to build up in the inner artery walls from damage, and that's from various causes. So once this damage is present, cholesterol begins to accumulate in the artery walls, and then an immune response happens and white blood cells are sent there because of this cholesterol buildup, and this causes even more inflammation in the artery walls. And then smooth muscle cells then form a layer over the buildup of cholesterol and white blood cells, which is like a cap to try and contain it from migrating to other areas in the bloodstream. And this plaque will continue to accumulate with this cap on top of it, leading to the narrowing and hardening of the artery. And this can lead to blood clots and from the plaque breaking off, or eventual blockage due to blood not being able to flow through properly. So this image is an angiogram and it shows the flow of blood using dye and it makes clots visible. So as you can see right here is the left coronary artery and there's a narrowing, which indicates that there's a blockage there and a decrease in blood flow. And then there's another one right here. As you can see, there's a little bit of narrowing and this decreases blood flow to the rest of the heart. A decrease or an inadequate amount of blood supplied to the heart can lead to several problems in the signs and symptoms that are associated with coronary artery disease. So the plaque buildup in the artery walls can lead to heart attack, heart failure, blood clots, and abnormal heartbeats due to the decrease of blood flow, oxygen, and nutrients to the rest of the heart. And this leads to symptoms like chest pain, pain radiating down the shoulder or arm, weakness, fatigue, nausea, lightheadedness, or dizziness, and then cold sweats. And these are all attributed to the lack of blood flow to the rest of the heart that contains essential oxygen and nutrients that the heart needs to function properly.
Risk factors of coronary artery disease include a person's age, their sex, which is whether they are male or female, their family history, if someone in their family has had coronary artery disease in the past, or heart problems, smoking, high blood pressure, high blood cholesterol levels, diabetes, being overweight or obesity, and also having that run in their family history, physical inactivity or a sedentary lifestyle, high stress, and an unhealthy diet. These risk factors often occur together and can trigger one another. For example, obesity can lead to type 2 diabetes and high blood pressure. And when these are grouped together, certain risk factors make you even more likely to develop this disease. Another example of this is metabolic syndrome, which is a cluster of conditions that include high blood pressure, high triglycerides, low HDL or good cholesterol, high insulin levels, and possible excess body fat around the waist. This can all lead to increases of the risk of coronary artery disease.
So next would be receiving a diagnosis for coronary artery disease. And first, your doctor will ask about any medical history, start off with a physical exam, and run some basic routine blood tests. He or she may suggest running some diagnostic tests as well. This will include an ECG, and the ECG will reveal evidence if there's any previous damage from a heart attack or if there's possibly a heart attack in progress. The next one is an echocardiogram, which will produce images of your heart, which will help your doctor determine whether all parts of your heart wall are contributing normally to your heart's pumping activity. The next option is doing a stress test. The first stress test is an exercise stress test, and this is only used if your symptoms occur when doing exercise, and most times an echocardiogram is attached to the patient, which is called a stress echo, and this will help produce images of the heart when stress is occurring to make sure everything is pumping well. The next stress test is a nuclear stress test. This is pretty much the same as an exercise stress test, but it adds images of the ECG recording, which will measure the blood flow to your heart muscles when the patient is at rest and when the patient is under stress. The next test would be a CT scan, and the CT scan will help your doctor see if there's any calcium deposits in your artery that can narrow down the arteries. If this is discovered, then it is most likely that you will be diagnosed with coronary artery disease. In order to treat coronary artery disease, some simple lifestyle changes will have to occur, such as exercising to lose excess weight, no smoking, eating healthier, and reducing stress levels. Some drugs and prescriptions can also be prescribed, such as a cholesterol modifying medication. This will reduce the material that deposits cholesterol into your coronary arteries. Next is a beta blocker, which will slow your heart rate, decrease your blood pressure, and decrease your heart's demand for oxygen, which will overall reduce the risk of future heart attacks. Along with beta blockers, it is prescribed with calcium channel blockers, and these channel blockers will help improve symptoms of chest pain. The next prescription is ACE and ARBs, and these drugs will also help decrease blood pressure and may also prevent progression of the coronary artery disease. And if more aggressive treatment is needed, a patient can have a bypass surgery, which is shown in the bigger picture to the right. And the surgery will allow blood to flow around the blocked or narrowed coronary artery. The next option would be to get an artery stent replacement, and this is often to keep the artery open, which is shown in the smaller picture. As far as the prognosis goes, it is considered a long-term premature prognosis, and if not treated properly, it can also lead to a premature lifespan.